Now, let's transition slightly because we need to cover a lot of territory together in these next few hours. Do you like pain? Anybody here like pain? Of course not. Do you like disease? Well, I don't know anybody that likes disease. Is the function of pain and disease a good function, or is it a bad function? Now, we all recognize that it's bad to have disease. It's bad to have pain. But is the function of it a good function or a bad function? Now, let's take leprosy as our example. Leprosy is a condition, a disease, an infectious disease where individuals have certain bacteria, Mycobacterium leprae, and that bacteria particularly likes cooler areas of the body, like fingers and toes and nose and ears and so on. And that bacteria, they get in there, there's an infection that happens, and it starts to destroy the nerves and the nerve endings in those areas so that the individual cannot feel pain anymore. Well, what happens when you can't feel pain anymore? There's nothing to keep you from harming yourself unawares because you can't feel it, right? The story is told of a missionary that worked in a leper colony, and he had a soft drink, a Sprite or a Coke or Pepsi, whatever it was. And it was the old bottle kind with a bottle top and so on. He didn't have a bottle opener, and he didn't have anything with him to open it, and he's trying to get this off, and he can't get it off, and a 12-year-old boy, leper boy, comes up and says, "Here, I'll help you." And he goes, and there he got it off, and he handed it to the missionary doctor. And the missionary doctor was like, "How did you do that?" And he got the boy, and he opened, and he looked at his hands, and his hand was all bloody. There was the cap, but it was all bloody. Why? Because he had held on so tight on those ridges of the bottle cap, and he had cut his hand open, but he didn't know he cut his hand open because he couldn't feel it. Right? So what happens in leprosy, and if you are a bit squeamish in regards to pictures, then you might just cover your eyes for the next few seconds, because I'm going to move on the next screen. And here's a picture of a leper and their hands. Why are they missing the ends of their fingers? Well, it's because they couldn't feel any pain. And so when it burns on the stove, they don't know it until they smell it or they see it. When something comes along and that bottle cap and so on, pain has a good function. It's to prevent you from continuing to harm yourself. It's got a good function, right? But it's not nice when we have pain. So is the function of pain good? The answer is yes. Is the function of disease good? It's the same answer. Yes, it is. It lets us know that there is a problem, that something's wrong, so that we can go look for what's wrong, and so that it can be fixed, right? So does disease just come out of thin air, or is there a cause to disease? Well, the answer is yes, there's a cause, and the question is, what is the cause of disease? Well, in order to understand that, we need to reason from cause to effect. Right? Reason from cause to effect. Or, I should say, reason from effect backwards to cause. So let's take high blood pressure as our example. Let's say that you have high blood pressure, or a family member of yours has high blood pressure, and we can ask ourselves, what's the cause of high blood pressure? Well, we might rightly say that it's vasoconstriction. That's where the blood vessels clamp down. They have little muscles in the blood vessel wall, and those muscles contract, and the blood vessel, instead of being big and open like that, clamps down and it gets smaller. Well, if you clamp down on the fluid that's inside of it, what happens to the pressure of the fluid inside? Well, the pressure inside goes up, right? So, okay, we've solved the problem. It's vasoconstriction, right? Okay, well, what's the cause of vasoconstriction? What's the cause of that? You see, if you found one cause, that doesn't mean that you found the root cause, because causes can have causes, right? Just like a chain of dominoes going together. Well, sure, the reason this domino fell over is because the domino before it fell over, but the question is, what caused that one to fall over? Well, that was the one before it, and the one before it, and before it, and before it. And to really find the cause, you want to find the first domino. So, what's the cause of vasoconstriction? What causes those muscles to contract? Well, it's the sympathetic nervous system. It's your fight or flight response. That's what's in charge of those small blood vessel muscles and causing them to constrict. So you have increased stimulation of your sympathetic nervous system. And then you have this increased blood pressure through the vasoconstriction. Well, great, we've solved the problem, correct? No. So what's the cause of the stimulation of the sympathetic nervous system? Well, one of those causes is a hormone called leptin. This is produced from the hypothalamus in the brain. And that leptin, what it does is a number of things. It helps to decrease an individual's appetite. It makes them feel full faster. It tends to speed up the metabolism a little bit. All of those fall off over a while, but it also stimulates the sympathetic nervous system and causes then that vasoconstriction to happen. Right? So we've solved the problem, right? Wrong. We still have a cause for that. So what's the cause for increased leptin? Well, we find it coming from increased adipose tissue, right? Now, I said before leptin came from the hypothalamus. The hypothalamus is where the leptin goes to in order to stimulate the sympathetic nervous system. Where it comes from is the fat tissue. It comes from the adipose tissue. So the more fat tissue, the more adipose tissue you have, the more leptin that you produce. So we've solved the problem, right? No. Where did the adipose tissue come from? The excess. Well, it came from excess calories, more energy in than you were putting out. And so then that needs to get stored somewhere, and it gets stored in the form of fat in the adipose tissue. Okay, what was the cause of that? Well, it was a diet where you had increased calorie-dense foods. So you're eating foods that have lots of calories in it. Usually the higher the calorie density, the lower the nutrition value of the food. And it makes you fat, but it doesn't make you healthy. Okay, well, where did that come from? Well, why is that? It's because we have a particular taste. We like the taste of that food that's high in calories, because it's usually high in fat and salt and so on, and sugar. Well, why do we have that particular taste? Well, because we've made repetitive choices. We've developed a habit of eating these things, and we've come to appreciate the taste of those different things. Where does that come from? Well, that comes from our appetite. Oh, where does the appetite come from? Well, that comes from our nature. And where does the nature come from that desires the foods that are killing us and causing high blood pressure? Oh, that comes from sin. So if we take any condition and we simply ask ourselves, what's the cause of that, then what's the cause of that, and 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 that, and that, and that, and that, and that, and that, we are always going to come back to this same root problem, and that is sin. Sin lies at the foundation of every dysfunction.